A new year means a new wave of high healthcare costs. With deductibles resetting and premiums going up, you could be paying more out of pocket this year.
Yeah, so health insurance can be a very complex, confusing issue,
Yeah.
no doubt about that. And with so many terms, so many policies and costs to try to figure out, it can get just really tough. So joining us live to help us save you some money on your health care is Cindy George, a personal finance expert with GoodRx. Good morning. Thank you for being here.
Thank you.
All right, so what are a few simple steps that Americans could take to try to reduce those out-of-pocket costs?
The first thing you want to do is ask about cost up front. Don't be afraid to ask questions of your physician, of the hospital, and even of your pharmacist about possible reductions in the cost of your care. The second thing you want to do is have health insurance. If you don't have job-based health insurance, see if you're eligible for Medicare or Medicaid or a plan on the Affordable Care Act marketplace. The last thing you want to do is price shop for medications, and GoodRx can help you find the best price in your community.
Yeah, sometimes that just taking that extra second to shop around really can make all the difference. It's so tough with healthcare though. It seems like it's one of the only things that we go into, really not knowing how much something's going to cost us. We just kind of go in, we get care, and
Wait
wait
for the
with
bill.
bated breath for that bill to show up. Yeah, so what are some of the questions that people could be asking their doctors or their insurance providers maybe beforehand to try and save some money?
Lots of questions. If you have a medication, ask your physician, is there something else that works just as well that may cost you less? For the hospitals, we have hospital price transparency now, where hospitals have to have their lists of services and items and the cost of those services and items available to you in advance so you know what they are. And of course, if you have health insurance, you need to look at your summary of benefits and understand what is covered by your insurance and take advantage of your preventive health benefits. They're available to you with no out-of-pocket costs.
That's good to know. And, like we said, this managing your healthcare finances can be so complicated and can really be complicated so quickly. There's got to be some common mistakes that people make in trying to manage those healthcare finances. What are those common mistakes?
Absolutely. Not understanding their insurance plan, not asking if they need prior authorization for a service, not asking if there is copayment or coinsurance that they're going to have to be responsible for. Certainly not finding out if the service is in network and going to an out-of-network provider and paying hundreds or thousands more than they should have. Also, you absolutely need to plan in advance so that you don't make these mistakes. And you need to ask questions, as I said, and you need to price shop for your medications.
So what should Americans be doing if they don't have employer-sponsored health insurance, if they don't have an option presented in front of them? Are there ways that people can find some help to navigate the Medicaid, Medicare, Affordable Care Act options?
If you don't qualify for any of those options, you may be eligible for community-based options. And so there are some things called federally qualified health centers, and you can access care there on a sliding scale that's affordable for you. There are also many safety net hospitals as well as rural health clinics where you may be able to receive care.
Okay, and what are the other tips that Americans can use to look for just cheaper prices on medications?
You absolutely want to visit goodrx.com online or on the app. You want to enter your medication and the dose, and we'll tell you the best price for that medication in your community.
Yeah, I actually had a pharmacist one time recommend. She said, go check on the GoodRx
Oh.
app and see if there's a cheaper option or a generic or, all good things to try and check because it really could save you some money. Yeah. Cindy George with GoodRx, thank you so much for joining us. Some great advice this morning.
Thank you.
And for more money-saving tips when it comes to shopping, healthcare, and more, you can check out all of our Wallet Wednesday segments on KOIN.com.